Hello, everyone. People have been inquiring on Facebook, have given private messages and things, and also people actually stop me, complete strangers, because you wear these glasses after you do cataract surgery, and so they see these, they ask what I had done. I tell them cataracts, and then they have a bunch of questions. I got to do this pretty soon, and the big one is how much pain is there? Well, there isn't any, so that's a good thing to know. No pain whatsoever. So I thought I'd walk you through how it went for me, so that way if you are looking at getting cataract surgery done in the near or far future, you'll know what to expect, at least for now. With the technology, it depends on how far out you have to have them. Technology may change, may not, but anyway, for now, here's what it's like for me. Um, you go into the normal check-in procedures, and then you go to a hallway where you sit in a nice chair, and then there's another person that sits there, and they finish the intake. They verify questions, ask you new ones. They start putting eye drops in your eyes. Now, I didn't know what these eye drops did. They're the first part of the numbing of your eyeball. And the reason I didn't know what they did, because I didn't feel anything, no sensation whatsoever. It's not at all like the dentist where you go in and you got that, we hate that. It's nothing like that at all. No sensation. So after they're done with you there, they take you into, it's your pre-op and post-op room. And put you in a nice comfortable bed. You take off your shirt, leave your pants on, put on a gown. They put in an IV, and the nurse will ask you some more questions. They keep putting eye drops in your eyes periodically, and the anesthesiologist comes by, and the doctor comes by, and everything's really easy to understand. I asked every one of them at the end of their spiel said, "Do you have any questions? How soon can I have a cup of coffee?" So you can't eat or drink any solids or liquids, nothing. They told me my cutoff point was 9 p.m. the night before the surgery. I probably got in, I'd say somewhere a little after 7, by the time they actually started to do something. I opted for 15 hours just to make it safe. And I wanted coffee. I wanted my morning coffee. I was okay not eating, but I wanted the coffee. So when they do the procedure, again, you don't feel anything. They do give you a very, very mild anesthesia. I hardly even noticed that either. So they go into your eye with something and they break up the cataract, and then they go in with something else and they vacuum it out. You don't see the tools. You can't see them doing. The only thing you see, I saw anyway, is these two kind of shapes that were like this, and one was kind of grayish, cloudy, and the other one was a color. I think it was purple, or maybe it was cobalt blue. It was one of those two. Anyway, and they kind of move around whenever they're doing whatever they're doing in there, and then they stitch you up. They put an eye patch on. You're done. You go back into the post-op place, which is where you started out, and then you stay there for about 30 minutes, and then they let you go home. And so they give you the glasses to wear, and they give you an eye patch to put on. So you put on your glasses, you get the wheelchair, go to the car, and that's it. Now, you can take your eye patch off 4 hours after the surgery. They said 4 hours, take it off. But you do have to wear it every time you sleep. And that's important because they don't want you rubbing your eyes in your sleep and, rubbing against the pillow, because it needs time for the lens to settle in, and you don't want to move that around. You don't want to break the stitches. So always wear the eye patch. Basically, just do whatever they tell you exactly. The day before, you've got eye drops. There's the antibiotic. There's this one that I don't know what it does. And I don't know what this one does, but that's the order you take them in. 4 times a day, every 4 hours, 5 to 10 minutes apart. I set an alarm on my phone, 8, 12, 4, and 8, so I wouldn't screw that up. So, and then I had a timer I upped for 6 minutes, so that way I could keep track of doing it, everything. The alarm go off, I hit the timer, take the eye drops, alarm go off with the timer, and do the routine that way. So you want to do everything they tell you to, because you want to make sure you don't screw up your second chance with your eyes. The other thing is you can't bend below your heart level for a few days. If you forget, It's quite a sensation. I went to get something out of the bottom cupboard. I needed a certain pen, and it was horrible. Um, I got up really quickly. Fortunately, didn't do any damage. But yeah, if you forget that once, you will not forget it again. So avoid doing that. Don't, and then they give you instructions like don't lift anything for a certain amount of time. Go out for the follow up, and then they'll tell you, or they told me, for the rest of the day, do the 3 eye drops, and then starting the following day, you just do the 2, but you only go down to twice a day. So you can eliminate the 2 middle alarms in your phone, and you're done. So anyway, what I saw when I opened my eyes after the first one and the second one, more so after the second one because now both eyes are seeing clearly. It's spectacular, amazing, awesome. We need to make words that are a level up from those, or quite a few levels up, to describe. It's just absolutely, it's amazing. It's wonderful. Um, my eyes were like 20 a million and a half or something for so many years. I'm now seeing 20/30 without glasses. I still have an astigmatism, and they're going to get me some new glasses. I'll get that done after the eyes have settled. Another week and a half from now. It's about 3 weeks out from the surgery. That's when that appointment is. And then I'll be seeing 20/20 again. So the main things you got to remember is that there is no pain, no sensation. It's really a nothing procedure as far as what you experience. And the results are, it's really, I can't describe how wonderful it is. So don't be afraid of it. Go do it. There's 3 levels of cataracts. There's mild, where they don't do anything yet, moderate, which is where I was at, and then there is severe, where if they could legally force you to do them, they would, but you should do them. I was just slightly above the center of moderate, but the thing is they don't have to, but some doctors will report you to the DMV, and I could have had my license restricted. He said I wasn't quite there yet, but that could come in a little bit of time, where you can't drive at night. And you guys know what I do for a living. I have to drive at night. So I said, let's just get these done before I can't see or before I have an accident, because most of my driving's at night. So that's why I did it in the time frame I did. Very happy I did it. I had no problems. It was just easy. And that's the main thing that I really want to impart with you guys is there is no pain, there's no sensation, there's nothing to worry about, and the benefits are astounding. So I hope I helped you if you're looking at cataract surgery in the future, and if you know somebody that they have cataracts, whatever the degree is, feel free to share this with them, alleviate their concerns. Again, I can only speak for what happened to me. The cataract surgeries that go wrong are like well below 1%. And they almost never happen. So it's really, as long as you do what you're supposed to do before and after, especially after, you're going to be fine. And you're going to love the results. And then you get to wear these really nice, cool glasses for a while. And people at the grocery store will put you in the front of the line because you think you're blind. So, Anyway, that's it for me. I hope to help you guys. You guys have a very good day now.